last, and I will talk about a phase 3 randomized trial of the Voxelotor in the Sickle disease. Definition: the disease is caused by a single amino acid substitution resulting in the production of the cycle hemoglobin polymerase when desoxygenated, resulting in the red cell cycle and the membrane damage.
Sickle cell disease is an inherited blood disorder, therefore it's lifelong, and at this current time there is no cure for most patients. The disease has two components. One is breakdown of the red cells that lead to a lower red cell content or anemia, and the other is blockage of the vessels. And this blockage of the vessels can lead to acute manifestations like vein crisis or lung problems, or can lead to slow but surely continuous damage to organs of the body, including the brain, the eyes, and so on.
The biggest challenge for sickle cell patients is trying to maintain, stay well. And unfortunately, I think most sickle cell patients learn to understand their own body, when they get much older. And we wish they could do it when they're younger, to try to predict when they can get a sickle crisis.
What did you learn from this video? Sickle cell disease is a lifelong disease, an infectious disease, an inherited blood disorder, a type of anemia. Blockage of blood vessels can lead to headache, dizziness, seizures, and stroke, chronic pain and pain crisis, lung problems, including acute chest syndrome, organ damage, including the brain and the eyes.
Application in the medicine. Voxelotor is a hemoglobin polymerase inhibitor that reversibly binds to the hemoglobin to stabilize the oxygenated hemoglobin state. One daily oral administration of Voxelotor has been shown to reduce red cell cycling and the blood viscosity and improve red cell deformability in the growth of the stem red cell, half-life, and reduce anemia and hemolysis in vivo.
Sure. The way oxybrita works is it actually binds to the hemoglobin molecule, and it increases the affinity of that molecule for oxygen. And by virtue of that increased binding of oxygen, it keeps the molecule in a more relaxed state. So the consequence of that is that it hides the parts of the abnormal hemoglobin molecule because of the genetic mutation that causes them to be sticky and to bind together and form these long chains or polymers. So by preventing the formation of those polymers, you're actually preventing the consequences of sickle cell disease, which is based on the damage to red blood cells that is really ultimately driven by that polymerization process. So and this is in fact the first-in-class hemoglobin polymerization inhibitor. That's the class of drug. The first time this class has ever been had a drug associated with it, and it's that mechanism that really drives the expectation that it really is treating the root cause of the disease, and that's the basis in part for the approval that the FDA provided under the accelerated approval path. Well, we're very committed as a company to making sure that patients can get access to the drug. We actually have a maybe best-in-class, first time we've ever had this robust a patient support program called GBT Source. And so it's a single point of contact for patients and physicians to figure out how to navigate the access landscape. We do expect, as with the case with new treatments, that there's going to be a period of time when payers, whether they be government or private payers, need to go through the process of making formulary decisions and determining their access plans. But ultimately, our expectation is that access will be broad and that patients will be able to get access to the medicine. And GBT is very committed to supporting that through a variety of means. The GBT Source Patient Hub is one of them, but also through copay assistance and free drug under certain situations with patients in need. So our goal is to make sure that every patient who, in consultation with their physician, believes that Oxbryta is right for them, that they will be able to get access to the medicine.
Pros and cons. Most persons will likely see that the 115 use of the Voxelotor increased hemoglobin levels and reduced the insight of the worsening anemia as compared with placebo. This trial was designed to evaluate the efficacy and safety of the Voxelotor as compared with placebo in adolescents and adults with sickle cell disease.
Americans are living with a disease you may know nothing about. Just this month, the FDA approved the first new drug to treat sickle cell disease in more than 20 years. I spoke with one man who says that small move could make a big difference.
It's not a disease that people passing would know is something that afflicts me.
Michael Loyacondo looks like a healthy 30-year-old man.
On your good days, you're operating at 30 to 40% capacity and energy as other people.
That's because Michael has sickle cell disease, a condition diagnosed at birth. It causes normally disc-shaped red blood cells to instead be sickle-shaped, causing a host of health issues.
Over time, that leads to a lot of difficulties with the tissues that are involved in that they simply don't get enough blood flow chronically, and so they don't work very well.
As a kid, I was playing sports, being subjected to high heat or jumping in an extremely cold pool or doing these things that for a lot of kids felt like a pretty mundane kid activity had sort of serious and sometimes dire consequences.
Those consequences are incredibly painful episodes.
Imagine being a child every time you go to bed. You don't know if you're going to wake up that night and be in screaming or excruciating pain, having to be shipped to the hospital as soon as possible.
You choose to listen a while with your hurt. A new drug called Endari could offer some relief. Dr. Beth Hellerstedt says it could reduce the frequency of those painful incidents.
Every single measure that we can do to be of assistance is going to be an improvement for these patients and their quality of life.
This is the first new drug approved for sickle cell in more than 20 years. Michael, a husband and father to a young son, is excited to see if Endari will work for him.
I was delighted to get the news. I probably had, half a dozen of my friends text me the day that I came out.
He hopes it's a new step toward a more normal life and of more new treatments to come.
Ideally, we'd like to find something to eradicate sickle cell, but this is a great step in the right direction, and more funding, research, resources dedicated to this, I think would have a profound impact.
There are a lot of sickle cell resources here in Central Texas. To learn more about Endari and other treatments, see the link with this story at cbsaustin.com. A new way to
is bleeding in Ecuador. In Ecuador, with these findings suggest that indeed approximately 13% of hemoglobin in all red cells with Voxelotor to stabilize to the oxygenated hemoglobin state may be sufficient in the inhibit polymerization red cell cycling and clinical sequelae of sickle cell disease.
Sickle cell disease is one of the most commonly inherited problems with hemoglobin or red blood cells. The sickle cell gene causes your red blood cells to be misshapen. Instead of being nice round circles like donuts, they become hard and stiff, kind of like a banana. those red blood cells aren't able to flow through your vessels. They get clogged and you can get complications, pain, and other organ damage as a result. One of the most common complications is something called a vaso-occlusive crisis or a pain crisis, where the blockage of blood vessels causes pain, and it can happen anywhere in someone's body. It's important for people with sickle cell disease to see a hematologist regularly because the disease is often ever-changing, and managing it is possible. There's regular follow-up with doctors, usually to help manage medications or blood transfusions on a regular basis. Is one of the specialty programs within the Center for Health Care. It is a hematologist or blood conditions. In addition, there the other support that's offered at the center. Essential healthcare needs like sickle cell disease often don't get the screening that they need for things like breast cancer or colon cancer because they're so focused on managing the chronic condition. For patients who get routine blood transfusions, we're able to do those in the infusion center, and for patients who have crises or other illnesses, we're able to do fluid management and antibiotics also in the infusion center. In addition, we do exchange transfusions, which some patients with sickle cell disease need on a regular basis. Our programs strive to partner with our patients to ensure that they experience the best health that they can. We are the only program in the area to the hematology care or the sickle cell disease together with primary care and the additional resources in one place, offering the best access for our patients. We are continually evolve the sickle cell program. One of our first steps to expand the hours and services offered at the infusion center to meet the needs of the patients.
Conclusion. In this phase 3 randomized placebo-controlled trial involving participants with sickle cell disease, Voxelotor only increased hemoglobin levels and reduced markers of the hemolysis. These findings are consistent with the elimination of the hemoglobin polymerization and indicated a disease-modifying potential.
Try to say right, because hopefully we'll soon have a for molecule. Could you maybe give us an overview of some of those leading ones in the pipeline, and then we can have a conversation about how we think that's going to affect the treatment of the patient and the payer market behind it?
Absolutely. So let's start with Voxelotor. Voxelotor is, as we discussed earlier, the mark sort of these sickle erythrocytes is the polymerization of sickle hemoglobin, and Voxelotor is being called a polymerization inhibitor. And then the way that it does that is by stabilizing hemoglobin in the oxygenated state. Of course, remembering that hemoglobin has to be deoxygenated for it to polymerize. Phase 3 study was recently published in the New England Journal of Medicine. It's a multi-center phase 3 placebo-controlled randomized controlled trial. It was a safety efficacy trial that looked at two dosing ranges, 1,500 milligrams and 100 milligrams. This is an oral medication that's taken once daily. With a primary endpoint, which was quite innovative, that looked at an increase in hemoglobin of 1 gram and what percentage of the patient population enrolled achieved that. The age range of this study was 12 to 65 years old. Actually, the results were quite promising. They showed that out of just under 300 patients enrolled, of which about 2/3 of them were on hydroxyurea, about half of them achieved a hemoglobin response at the high dose levels.
which was very statistically significant compared to the placebo group. And they looked at how hemoglobin changed basically from initiation of the study to week 24. So sort of the delta of where patients moved up. They also looked at markers of hemolysis to ensure that there was an effect on decrease in hemolysis in these patients, and then they were able to show, as their secondary, they were able to show some reduction in things like billing and other markers of hemolysis.
And based on the administration frequency, how do you think that would affect patients?
It's amazing to be able to have a medication that will be once a day and oral. It's always tough with medication, and adherence is an issue. We have to start becoming innovative as providers on how we are going to sort of push the button on adherence. It's really beyond making the patient take the medication in the clinic. It's hard for us to stay on top of that, but we just have to become innovative on how that is.
Where would you see using?
For me, the idea of potentially having a medication that can increase hemoglobin by at least a gram for most of my patients and potentially reduce their risk of progression to multi-organ failure. A drug that suppresses sort of organ preservation and potentially decrease risk of stroke. For me, it seems like a sort of foregone conclusion. I want as many patients as possible